A very good evening to everybody, to all the members of Rotary Club of Bombay Bayview and their friends and family members who have assembled here on this meeting for a very, very interesting talk. So friends, before we start the meeting, a small but a big announcement from the Rotary Club of Bombay Bayview. Friends, our Saint very happy to announce that our e-learning project of Saint Catherine School is set to start because we have received our global grant has been approved of the value of $70,250, and we should be getting the funds very soon, and the project should be starting very, very quickly. So this was a small but a big announcement from my side. And friends, we move forward with our meeting. Can I invite Ripa to introduce Dr. Ashwin? Ripa?
Hi. Uh, Good evening, friends. It is my absolute honor and privilege to introduce our speaker for this evening, Padma Shri Award winner and one of the foremost cardiologists of our country, Dr. Ashwin Mehta. He is also the father of our own member, Dr. Himalini Samant. Dr. Mehta is the Director of Cardiology at Jaslok Hospital, an honorary consultant cardiologist at Breach Candy Hospital, HN Reliance Hospital, and SR Mehta Hospital. He was a former professor of cardiology at University of Mumbai. He stood first class first with distinction in various subjects in MBBS and MD and
Wow.
19 gold medals at the University of Mumbai. Some of Dr. Mehta's milestones are pioneer in starting cardiac catheterization and angiography in newborn babies in India in 1973, performed or supervised more than 15,000 angioplasties, more than 65,000 angiographies, and 27 TAVR procedures. The list of awards that Dr. Mehta has received is a very long one, but just to mention a few, he was conferred with the prestigious Padma Shri Award by the Government of India in 2004, contribution in cardiology by the Government of Maharashtra in 2004, Most Outstanding Young Person of the Year Award by the JCs in 1978. This he shared with Amitabh Bachchan. Lifetime Achievement Award at the first IJCTO meet, June 2013. Lifetime Achievement Award at the CSI Conference 2018. Lifetime Achievement Award by the Asia Pacific Vascular Intervention Course Society, June 2019. He received the prestigious Dronacharya of the Interventional Cardiology Award in 2019. Some of Dr. Mehta's social service and educational activities are he provided free service and free medical education to students at Sion Medical College for more than 25 years. He is a teacher for undergraduate, postgraduate, and super specialty students for nearly 25 years at Sion Hospital and Medical College and is currently on the DNB board. He was an invited teacher at France, Japan, China, Italy, USA, Sri Lanka, and Singapore for demonstrating techniques of angioplasty. Dr. Mehta has been featured in more than 700 publications, presentations in various national and international meetings. So friends, without further ado, may I present Padma Shri Dr. Ashwin Mehta.
Um, Thank you very much, Rotarian President Smita Parekh, um, the, the Secretary or the Chairman of the Speakers Committee, Kartikeya Desai, my sweet daughter, Himalini, whom I see now smiling at me and encouraging me to speak well, and also the fellow Rotarians. Well, first of all, why did I choose this subject? Because I realized over a period of time that 65% of the patients who get admitted with me in my ICU were never sick before. Never. All those people who get the heart attack, large number of them would tell us that they never had experienced any chest pain. Time and again, you have traveled with your friend in United States, Europe, climbed mountains, and when you come back home, you suddenly realize that your friend had developed a heart attack. So it comes like a bolt from the blue. And therefore, very important that we know about that are we candidate for a heart attack or not. All right. So now I have some interesting slides which I want to share with you. Just give me the screen rights, please. Okay, you have already given me screen rights. Okay, right. Now, I hope you're able to see my slides well. Smita, can you see my slides well?
Yes, sir. It
Yes,
is
yes.
visible.
Yes, doc. Very, very clear.
One person dies every 33 seconds due to a heart attack in India. A good and kind heart is nice, but you must keep it healthy. You know, the heart makes a beat of 198,000 times in a day. And if you sum up all the energy that heart spends in one lifetime, and if you gather it together, it can lift up the heaviest battleship 5 feet above the ground. Such a powerful organ, I wonder how we can wreck it unless you do really drastically wrong things. We can't wreck it. It's such a powerful pump ever made by anybody in the world, and only an Almighty can do that. India has the highest rate of heart attacks in the whole world. And by 2025, we will be the capital of the world in diabetes. 1/5 of the deaths in India are from coronary heart disease. And we people suffer from the heart disease 10 years earlier as compared to our Western country friends. If you live in the cities and the towns, you have a 3 times higher chance of suffering from a heart attack. Traditionally, our diet is rich in carbohydrate, particularly the vegetarian. And if I were to talk of South Indian, whose staple food is rice, idli, dosa, uttapam, and they consume 400 grams of carbohydrate every day. Very little physical activity due to lack of space, facilities, lack of an exercise culture, and little interest in the sports. You will be shocked to know that our school going boys and girls, our children, our kids, spend 2.5 hours every day in front of a fluorescent screen. Either it could be a mobile phone, or it could be a video, or it could be a movie, or it could be a television. Whereas I feel that they should be spending their time on the football ground. They are glued to the sofa, and what we call is a potato couch syndrome. They're lying on the couch, eating junk food, watching TV. That's really unfortunate. And there is a higher incidence of obesity. There is an incidence of 14% of obesity in school going children. Very, very bad. Diabetes and heart disease, if there is a family background of obesity, diabetes, and heart disease, then I think you are at a higher risk of developing heart disease too. And hereditary, well, if both your parents have heart problem, then I think your chances of developing heart disease is 75%. That I think, therefore, unfortunately, you and I, we all know very well that we have no right to select our parents. But nevertheless, I will talk to you what can be done and what cannot be done. Well, first of all, heart disease is an aging process too. Some people come to me and at the age of 70 say, Doctor, I'm perfectly okay. I have no blocks. All right, I say, all right, never mind. Come back to me after about 10 years, and there he is. So this is a kind of a wear and tear phenomenon. Just as arthritis, cataract, graying of hair, and all are this age-related wear and tear phenomenon, so is heart disease too. Female people, female sex or has less heart disease, and below the, well, in the childbearing period between 12 and 50, the childbearing period means 12 and 50, the heart disease is 8 times more common in men. But after the age of 50, it starts catching up, and by about 55 to 60, the ratio is 1 to 1. Race. As I told you, we, the Indian people, are more prone to develop heart disease as compared to our counterparts in the Western countries. Strong family history, we already discussed about it, but what you can certainly help is enumerated on the right hand side of the slide. Cholesterol, wrong food, junk food, pizza, hot, what should I say, uh, uh, potato chips, and so on and so forth. Tobacco in any form, be it cigarettes, be it hookah, be it chewing pans, tobacco, whatever it is very, very harmful. High blood pressure raises the incidence of heart attack considerably, and so does diabetes and obesity. Alcohol, people say that the alcohol is a vasodilator and it helps. Yes, it could be in a moderate quantity consumed, but when you consume too much, not only you keep on putting on weight, but you damage your liver. And importantly, we have time for everything except that time we don't have time for our own selves. We do not do any physical activity whatsoever. And I think the modern lifestyle is such that we use the lifts, we use the motor car, we travel from one place to other place without any physical activity whatsoever, which I think has led to increase in the number of heart attacks in the country or in the society in general. In 2001, when the TV was maybe comparatively new, you'll watch your TV for a while and whatnot. But see what has happened, the physical inactivity. And look at this change in the shape. And this is what 2017. Incidence of obesity, 14% of the school-going children are obese. And unfortunately, there's a misconception. Many mothers think the healthy baby is a chubby baby. Wrong. That's very, very wrong. And the food habits are inculcated right from the childhood. And therefore, when the children are taught to please the parents that if I eat more and if I'm chubby, my mother would love me more. And if that is inculcated right from the childhood, no wonder why we have 14% incidence of obesity in school going children. And look at this gentleman. This gentleman is sitting on the treadmill. And look how he's doing. His legs are moving and he's consuming what he loves to. And look, he has alcohol, he has potatoes, he has eggs, he has dry fruits, and whatnot. And he is fooling you and me both that his chair is steady and the legs are moving. Wonderful. This is what we are doing to ourselves. All right. Okay. Let's go to the next slide. Okay. Let's talk about cholesterol. There are lots of myths about cholesterol. Low, normal, high, and alarmingly high. These are the various levels of cholesterol. And there are some misconceptions. You don't have to be fat or overweight to have high cholesterol. Your cholesterol level is not only related to the amount of fats that you eat, but it is the amount of cholesterol that your liver makes in your body. The cholesterol is made by our body even if you stop eating fatty substances. What happens is that the cholesterol is actually cleavaged and metabolized from the blood, and the blood level is kept at a reasonably constant level by the liver enzymes. When there is a defect in the liver enzymes, no matter what you eat, the cholesterol level is likely to go high. And mind you, all cholesterol in blood is not bad. Cholesterol is needed for pigments in the eyes. Cholesterol is also needed for making corticosteroids and hormones in the body. So cholesterol is not necessarily a useless substance and harmful substance alone, but excess of cholesterol can certainly be harmful. And we will discuss 65% of the cholesterol comes from the liver and 35 comes from the food. And this cholesterol can build up the plaques in your blood vessel, and they get accumulated and they create a plaque of cholesterol. And this plaque, when it is when it is very soft, all of a sudden it can rupture, and the plaque leads to a clot formation, and the clot formation results into a heart attack. Now, let us talk about few things about the heart attack. You see, as I told you, that the heart attack very often comes as a bolt from the blue. And how does this happen? Well, unless the artery is obstructed to a tune of 70% with cholesterol, it is not considered as a flow limiting, so much so that neither the patient nor the doctor comes to know that the patient's artery is blocked to a 70% because it does not produce any symptoms whatsoever. Then how do I come to know? Is the sudden heart attack is the only way that I come to know that I'm a heart patient? It's too late for me, doctor. So what should I do? Well, the reason is this. When the plaque is soft, then it is 50% blocked, 30% blocked, but it is soft in nature. Under some situation of stress, like internal stress or outer stress, the plaque ruptures. When the plaque ruptures, a 50% plaque now starts attracting platelets and the clotting material from the blood, and that accumulates, and a small little clot is formed on that ruptured plaque. And the plaque, which was blocking the artery to a tune of only 50%, progresses, and within a matter of few hours, the artery gets 100% blocked. At that point of time, the heart attack occurs when the artery is 100% blocked. And at that point of time, when the heart attack occurs, there is a electrical instability created inside the heart, and the heart goes into cardiac arrest. Before you get even a time to call a doctor or make even a phone call, the patient dies. Why? Once the heart stops due to auto-electrical shocking because of electrical instability, you do not have more than 3 to 4 minutes of time for making that patient survive or improve his chances of survival. This is too much because within 3 to 4 minutes, you won't be able to dial your friend. So therefore, how to remedy, how to be prepared, I will talk at the end. Well, never mind. All food containing animal fat and meat products should be significantly minimized, and therefore the food and the one cholesterol made in your body combined together, at least 35% of that you can reduce. Remaining 65% coming from the liver, I will show you what medication can considerably modify that and reduce your risk of cholesterol forming the plaque in your body. Obesity. As you increase your waistline, so you decrease your the lifeline. And your waist and hips ratio is important. The body mass index, BMI, which you hear commonly, and you might, some of you who are well-informed people, the Rotarians are, that you read a lot, and BMI is a weight in kilogram divided by height in meters square. Normal BMI is 18.5 to 23. Higher the BMI, shorter is your lifeline. How to calculate ideal body weight? Heights, maximum BMI, and you multiply by square of a meter for your height and with your weight and with your BMI, and that is what you get, what is known as an body weight index. Hypertension. High blood pressure increases the risk of coronary disease by 1.5 to 3 times. But what do I call high blood pressure? What is high blood pressure? Currently, I think the Committee on Hypertension and WHO has ruled that any blood pressure above 140/90 at any given time and at given age should be considered as high blood pressure. And it is not possible to control the blood pressure 24 hours a day, every minute, every second. No, they are the live pipes. The blood vessels are live pipes. They have a life, they are dynamic. They are not rigid pipes like our water pipes, and therefore the blood pressure does fluctuate. To give you an example, that if you take a sharp curve with your car, or you come across any obstruction, or suddenly you come across any obstacle and you jam your brake, your blood pressure can go up to 210 to 220 at that moment. And similarly, the jockey riding on a horse and uh, uh, participating in obstacle race, They find that when they jump the obstacle, the horse's blood pressure goes to 350 and the jockey's blood pressure can go up to 210. So it's a dynamic process, but if you have a consistently high blood pressure, above 150 by 90 on 3 different occasions, then I think you should consider that you are suffering from hypertension, and it is advisable that you consult your doctor. Diabetes, as I told you already, we, the Indians, have a highest incidence of diabetes, and by 2025, we will be the world capital of diabetes. 2 out of 3 people with diabetes die of heart disease or a stroke. And if you have diabetes, you have 2 to 4 times more likelihood to have a heart disease or a stroke than if you had no diabetes at all. Okay. Now, how do I know? You know, vast majority of the people come to know that they have hypertension and diabetes only when they go for their insurance. When the insurance man, doctor examines, he says, sir, you have a diabetes and you have hypertension. And because these two are the silent killers, they can keep on existing in you for years together without your knowledge. And when they come, it's too late. When you come to know, it's little too late. And therefore, it is a good idea that you undergo periodic checks. Make yourself available to a doctor to check that you have high blood pressure or diabetes or not. Very good. And strict control of both. Like, for example, if the diabetes patient and hypertension, especially hypertension, if he keeps, patient with hypertension keeps his blood pressure under control, then he is as good as no hypertension. His lifespan is same as people having no hypertension. Very good. Now, smoking. 1 cigarette reduces your life by 13 minutes. And therefore, if the people who smoke more than 5 cigarettes are considered as a smoker, and smoking doubles the risk of heart attack. Apart from that, smoking can lead to lung cancer, cancer of the tongue, acidity, so on and so forth. I would say the patient comes to me and says, doctor, I can't give up smoking. Then I have to tell him, find out another doctor, because those people who do not promise me that they are not going to give up smoking, I do not see any point in treating them. Well, alcohol in small amount is beneficial. Maybe a small glass of wine. But in a large amount, it adds to the fats and the calories and raises the blood pressure. So you can see this nice lady. This is uh, particularly so because the alcohol affects uh, female patients more adversely than the male patients. And when I say a glass of wine, look at the glass that they can manipulate to drink. Who should be worried? Who are the people who are at a high risk of development of heart attack? One, those who have a family history of high blood pressure, high sugar, and heart disease. People who are overweight, obese, whose BMI is more than 23 kg per meter square. Those whose abdominal circumference is more than 36 inch for the males and 32 inches for the females, they are at a higher risk of developing heart attack. Blood pressure consistently on a various occasions is more than 140 by 90. Yes. I have to talk a little bit more about high cholesterol, more than 200. Our recent data shows that the total cholesterol of more than 200 certainly is bad, but more importantly, you should get your cholesterol classified. There are 2 varieties of cholesterol, a good cholesterol and the bad cholesterol. The good cholesterol is known as a HDL or high density lipoprotein cholesterol, and the bad cholesterol is LDL or a low density lipoprotein cholesterol. Currently, we believe that people who have an LDL cholesterol more than 70 are at an increased risk of heart attack. And people who have an HDL cholesterol more than 50 have a beneficial impact on their incidence of heart attack. In fact, above the 65, every 1 milligram of HDL cholesterol reduces the heart attack by 2%. And LDL cholesterol is actually a cementing substance. It is the brick for developing cholesterol plaque. And if your LDL cholesterol is low, it is associated with a longer and healthier survival. Smoker, tobacco chewer, and I have an interesting story. Once a very rich man was traveling by the first class compartment of the train, and along with him there was a co-passenger who was traveling at the company's account, and he was an accountant. This rich gentleman was smoking a cigar, a Hawaiian cigar. So curious enough, the accountant asked me, "Sir, how many cigars do you smoke per day?" He said, "I smoke 3 to 4 cigars per day." "And for how long have you been smoking?" He said, "I'm smoking for the last 25 to 30 years. Oh, so he quickly calculated being an accountant and said, "Sir, if you had not smoking, you know the building that we see here, that could have been yours." So the rich man asked him, "Do you have such a building?" He says, "No." "So let me tell you, that building is mine." Alcohol is, we already discussed, in excess, the alcohol can lead to even cirrhosis of liver, and alcohol can bring about a lot of changes. And it has been said that 15,000 neurons are destroyed by one peg of alcohol. So when you are old and when you have less number of neurons in your brain, every neuron counts. You should not have alcohol in excess at least. What about the interactions of the various risk factors? They are multiplicative, and many of these risk factors coexist. And which are they? Obesity, hypertension, diabetes, they can all coexist together. And the risk factors are often clustered together and they multiply. So therefore, I believe that Framingham study classifies the low risk, medium risk, and high risk. High risk patients in any case are very obvious. Somebody who has a diabetes, hypertension, family history is going to be under my constant vision, under my supervision. The low, we don't worry about low risk people. It is the intermediate risk who will immediately step into a high risk. Those are the patients who I have to watch very closely, carefully. And those are the patients who have to take intense care about their health so that their risk factors are adequately controlled and they could live or a healthy life by postponing the danger of heart attack for a. Now, misfortune always comes in by a door that has been left open for them, and that is how the heart attack easily scripts into you. So, creative strategies which do not work. Well, I don't believe in testing. I don't want to go for tests. I've never been to a doctor because I hate them. I don't take medicines because I believe in naturopathy. My BP is normal, so I stopped all medications. BP promptly comes back. BP treatment is practically lifetime in almost 85% of the people. I am my own doctor. I don't have to pay fees also. And the creative strategies that we have in India, Tantra Mantra ke Samrat, Kale ke Silfi, Ilm ke Mahir, Baba Ali Khan for anything. आपको कोई भी जातनी तकलीफ हो, बीमारी से परेशान, दुश्मन से छुटकारा, शैतान से छुटकारा, कारोबार में नुकसान, health, everything 100% guaranteed, and they flourish in our country like mushrooms. What should be done? Well, everyone who is above the age of 35 years of age and earlier, if provided if he has a family history, diabetes, hypertension, tobacco usage, and obesity. If they have this, they should have a regular checkup. And because I told you that you will get a very shocking surprise, the doctor finds out that you have a blood sugar level of 300 to 400. And that's the first time you come to know that you have diabetes. Too late. So have a regular checkup. All right. And exercise regularly for 30 minutes, 5 times in a week. This is more than enough. You don't have to be competitive. If you are playing tennis, play doubles. If you are walking, walk for brisk walk 30 minutes. What is a brisk walk? There are 3 types of walk which I describe to my patient. One is a Bharati walk. When you go and attend the Bharat, I think the ladies are singing in front and the band is going and you just leisurely have a stroll. That's a Bharati walk. That's not a walk. 2, there is a Pagal Kutta behind you and you run. That also is not the kind of walk that you should do. The walk is something which you are going to catch the train. You're just in time. You don't want to talk to anybody, and you don't want to also waste time looking around here and there. You just walk non-stop with a little brisk, with a little sense of emergency. That is a kind of a walk you should make. Well, brisk walk, swimming, all those things count. And not only you consume calorie, reduce your body weight, shape up yourself, but reduce the incidence of heart attack also. All right, 10,000 steps. That is what is recommended daily for a healthy heart. Active person always should indulge himself. And mind you, there are various ways. People who don't find time, I tell them that drop your car at the preceding station and walk to home, and your driver will bring it. In case if you don't have a time, make a habit that you go and walk upstairs to your office on the 5th floor. Something is better than nothing. And I think if you don't have a time to walk for 30 minutes a day, then I think it's not worth it. I think we have a time to give our car regularly for a repair and be upset in case if there is a noise coming from the car, and we are so fastidious or meticulous about the maintenance of our instruments, cars and whatnot, but not about our heart. I think it's shameful. Eat healthy, and here it is, Shiv Vada Pav. And when we had gone to attend uh, Kokila Ben's 75th birthday, there was a lavish table of dessert, and there was a big crowd there. So I told Jyoti, my wife, that don't worry, see here, there's a very big crowd, and I think therefore our future is great. You don't worry. And this is what I think the tables are laid with, and people eat this kind of food day in and day out. The social people who are very highly sociable get invited or invite people 5 times in a week, and that is the food, the 5-star hotel food that they keep on consuming for years together. So the dietary guidelines: limit your intake of food high in calories and low in nutrition, including foods like soft drinks, candy, and the junk food. And limit foods high in saturated trans fat and cholesterol. Like, for example, the hamburger, pizza, vada pav. Once in a while, I can understand that you, after all, we are not sadhus and we don't want to restrict our life to that extent that we feel miserable. But people who consume regularly the couch potato syndrome, that our children, our school going boys and girls do that, that I think is seriously wrong. Salt intake should be less than 6 grams per day. You know, till 1908, there was no salt in East Africa. Madhwan is carried salt there, and thereafter there was a 3 to 5 times rise in the incidence of high blood pressure in East Africa. Saturated fats, increase in cholesterol, avoid coconut oil, palm oil, vanaspati ghee. Monounsaturated fats are good, like olive oil, groundnut oil, canola, mustard oil. And the polyunsaturated fats can also be used alternatively, like sunflower oil, soybean oil. Omega-3 fatty acids and fish oil can keep your heart healthy, and you can change periodically some oil at some point of time. And if you get bored, you can change to either polyunsaturated to monounsaturated fats for your cooking purposes. Drink at least 2 to 3 liters of water every day. Exceptions in patients with heart and kidney failure. They are to be guided by their doctor. Rethink before you drink. You have a lot of choices. You have green tea, Coca-Cola, you have a Red Bull, and whatnot. So be careful. Whatever you drink, see what you are drinking. Make sure that you drink a right kind of. The drinks which are preferred are spiced buttermilk and fruits and fruit juices. Okay, breakfast should be lunch and dinner. If your dinner is very heavy, lunch is light, and breakfast is very mild or very frugal, then you will develop this kind of a shape. But a good breakfast, light lunch, and a very light dinner will change your shape, and this is what you should have. Very good. Be patient. Blood pressure, we already discussed, should be 140 by 90. And in that range, it cannot be a rigid figure, but you can uh, keep it within that range. And the good diabetes control is one where your HbA1c, which gives you an average of blood sugar over a period of the last 3 months, and it should be between 6 to 6.5. And in most of the patients, it should be less than 7. If it is 7.5 to 8, your diabetes is not in good control. Insist on your expert diabetes doctor that he helps you to bring it down to 7.5 to 8. And LDL cholesterol should be less than 100, but I personally believe it should be less than 70. HDL cholesterol should be more than 40. It's not. You know, the per capita ice cream consumption is highest in the whole world in Gujarat. 14% of all the Indian population, the Gujaratis, develop heart. So incidence of heart attacks in Gujarat is very high. I think it could be related to jalebi, gatia, and ice cream. In Ahmedabad, if you go, every street corner, there is an ice cream parlor. This is what we pay for that. Risk of cardiovascular disease reduced to normal by 3 years after stopping. So don't anticipate benefit. If you stop cigarettes, it takes about 3 years to reverse the bad effect that is already existing in your body due to tobacco. All right. And one more thing, 80% of the diseases are psychosomatic. That is, they are man-made. And I think, therefore, if there is a healthy mind, healthy living, healthy habits, then I think you should continue to enjoy good health. And finally, mental and social health. Remedy of all kinds of illnesses in yoga and healthy lifestyle, so says Baba Ramdev. And 80% of the, Baba Ramdev, and regular checkups, yearly exercise, stress test for all above the age of 35 and 40, regular BP monitoring, lipid profile testing, and screening for diabetes. In case if you get first time ever unexplained chest discomfort, then I think you should never ignore. Let me explain to you what kind of a pain should be considered as related to heart and create a strong suspicion in your mind about heart. Well, heart pain usually occurs in the center of the chest. Although heart lies on the left hand side, pain is not very commonly in the left hand side, but in the center. It is felt as a crushing, gripping, compressing, as though there is a mountain on my chest, and as if you are being squeezed between the two walls. That's kind of an experience the heart pain can give you. It can radiate to the neck, to the left arm, to the right arm, to both arms, or to the upper abdomen. And sometimes, mind you, sometimes it may not be in the chest at all, and it may be only in the arm. But then how do I know? A pain which occurs on physical activity, like a brisk walk, and you start experiencing discomfort in the chest, or a brisk walk and you find choking sensation in the neck, not in the chest, but only in the neck, and you stop and the discomfort vanishes. Believe me, 9 out of 10 times, you will be right if you suspect that this is heart. A man who is 45, 50, who's been enjoying completely good health, but he has stress and diabetes, and he gets up in the middle of the night with a discomfort in the chest for the first time in the life, believe me, he'll be more often right if he suspects that this is heart problem and rushes himself immediately to the nearest hospital. He will be doing good to him. 50% of the people who die due to heart attack die before they even reach the hospital. So therefore, moment you get any warning, even a suspicion, is good enough to make you aware that you should contact doctor immediately and go to the nearest medical center. This is very, very important, especially people above the age of 45 or 50. Okay, remember, health management is free and enjoyable, but the disease management is very costly and painful. And so now, finally, I would leave you all for questions and answers. I'm sure lots of questions, lots of inquisities, and lot of inquiries would be from your side for me. Thank you very much, Smita.
Thank you, doctor. That was a superb session. Guys, whoever wants to ask a question, please unmute yourself one by one and we can ask the questions.
I have a question.
Yeah.
Doc, I wanted to find out, sometimes you get this pain, which usually is confused with gas, but you actually think it's like a heavy sensation on near your left chest area. And then it kind of subsides in a few minutes. So how do you differentiate between both these phenomenons?
I think that's a very, very good question. But there is a close correlation between the symptoms created by indigestion and the symptoms due to acute insufficiency of blood supply to the heart. And how it's very confusing. And let me tell you and assure you that this confusion has taken in the minds of even doctors when they have sustained a heart attack and they have mistaken it for a gas and delayed their treatment. The heart, the doctors themselves. So I don't blame you. These kind of questions are an important one, but I think in this situation, let me give you one or two hints. If you feel the discomfort is better and there is a significant relief by sitting upright or standing, then chances are that the discomfort is due to heart. And although the heart pain, while people who walk and at some distance they feel as if gassy feeling and the heaviness in the chest, they wait and burp a couple of times and they feel relieved. I would say better to err on the heart side rather than to gas. Let your doctor find out what is the difference. Is it a heart pain or is it just a gas pain or otherwise? I think especially when you have one or two risk factors like diabetes or hypertension, and this you are experiencing in your uh, age of 45 and above, I think then once at least when you get these kind of symptoms, consult your doctor.
Great. Thank you. Thank you, Doc. Thank you so much.
Doctor, if your HDL is low, 27, 20, how bad is that? And your other cholesterol levels are fine.
HDL, all right. HDL is unfortunately not very easily influenced. Like there are no medications which can raise HDL to a significant level. We, the Indian people, have this kind of a scenario. Our total cholesterol is moderately high. Our HDL is always low. Our LDL is moderately high, and our triglycerides are moderately high. This pattern is specific for the Indian race. Now, there are two things which can raise HDL to some extent, and that is alcohol and physical activity. Now, they all raise to a small extent. So HDL, when it is not very high, I now overcome this problem by bringing the LDL as low as possible. Somebody whose HDL is 27 and I know I will not be able to bring it to about 40, then I try to keep their LDL below 50, 50. That's how I counterbalance it.
Okay. Okay, doctor. Thank you so much.
Is it a good idea to keep 2 tablets of sorbitrate in your wallet, just in case of emergency?
No, no. That's not at all a good idea. The reason is simple. Many times, some kind of a muscle ache, some kind of a muscle pull, or some kind of a non-cardiac pain, which you might not recognize what it is, and you take a sorbitrate. In some people, the sorbitrate brings about a drop in blood pressure, and you're likely to fall or faint. So I would not advise that. People who have a proven heart disease and who have experienced the heart pain in the past, who are capable of recognizing the heart pain in future as and when it comes again, they could benefit by keeping one aspirin and one sorbitrate in their wallet. But de novo, people who are experiencing chest pain for the first time, who are not even very clear whether they have any heart disease in the past or not, they should not do that.
Okay, recently, there was a case where a young boy was playing badminton. He was probably in his early 40s. And he completely fit, non-alcoholic, never smoked in his life, fitness to the T, played a heavy game of badminton and just in a matter of few seconds collapsed and died on the spot. What do you think happened to this person?
This is what I was alluding to when I said this sudden heart attack. As I told you, 65 to 70% of the patients who get admitted to ICU never ever had any symptoms in the past. So, how did it come? It came overnight? Well, let me tell you. When there is a plaque formation due to cholesterol in your blood vessel, that plaque, unless it occludes the lumen of the artery to a tune of 70% or more, the patient will not experience any symptom. These are the plaques which are 30, 40, 50% in severity. They are very mild plaques, but they are soft plaques. So if there is an acute stress brought onto the heart by very vigorous physical activity, that plaque ruptures. Once the plaque ruptures, the content of the plaque are brought into the blood lumen, the vessel lumen, and immediately platelets rush there. Any trauma, any breach in the continuity of the blood vessel, the platelets are the first defense mechanism, and they rush to the site of rupture. And the platelets, when disintegrate, they start making clot formation. A 50% block within few minutes to few hours will become 100% block and bring about a massive heart attack. Therefore, whenever you have a doubtful that you are at the risk of developing plaque, that is which I told you about, the various risk factors, diabetes, hypertension, obesity, stress, and whatnot. I think these people, it is good idea to keep them on statins. Statins are those medications which lower cholesterol. Not only the lower cholesterol, but the soft plaque is very often converted into a hard plaque. Such hard plaques do not rupture. And that, I think, we have a lot of data coming up that they may be helpful to prevent sudden cardiac death.
Doctor, you mentioned, sorry. Doctor, you mentioned about the cholesterol generated by fatty liver or liver, and you had mentioned that you would be providing a solution for that. What is...
Okay, all right. So, irrespective of symptoms, when your cholesterol level is high, you should consult immediately your doctor. Not only you should keep on controlling the diet, but there are certain cholesterol level which my judgment will tell me will not come down by merely diet alone. Then we prescribe the drugs called statin. Statin is such a discovery that the discoverer of the statin, Goldstein, got a Nobel Prize. So therefore, if for nothing else but to pay tribute to him for his outstanding work on statins and cholesterol, statins should be taken in all those people who have a high cholesterol and not controlled by diet alone. Keeping cholesterol, LDL level, increases the lifespan, delays the incidence of heart attack, and even when the heart attack occurs, is very often mild. So statin, under the prescription given by your doctor and under his supervision, should be taken for all those who have a high cholesterol level, or even if they have not got a high cholesterol level, even a moderate cholesterol level, but if they have other risk factors like strong family history, diabetes, hypertension, past history of smoking, they should take statins.
Well, I have a question. Can I ask, please?
Yeah, okay.
Yeah.
Doctor,
I have two
can
questions.
I take a question?
Yeah, one by one, guys. One by one.
Sorry.
I'm okay, Smita. You decide when you want to end the meeting.
No, that's fine. So we can start the meeting till 8:30.
Then you have place for two questions.
Yeah, I have two questions to ask Dr. Ashwin Mehta. One is, can a heart patient who has undergone angioplasty and with one stent, he can climb the stairs if he has got no problem in climbing it? Number one.
Yeah.
Now, second question is, because of the low functioning of the heart, there is a water retention in the body. How it can be cured? Thank you.
Oh, very, very interesting question. Very good questions. In 1988, when I did my first angioplasty on the patient was on a world tour. And the tour had rested in Bombay for about a day or two. And this gentleman developed a heart attack. And I quickly took him on the table and opened up his artery, and his heart attack completely reversed. And then I advised him to take a rest for a few days, but he wouldn't listen to me. By that time, the whole group of the tour had gone to Bangkok. And from Bangkok, they all went to Singapore. This gentleman who had lost some time flew from Bombay to Singapore and joined the tour again. And at the end of the complete world tour, he wrote a nice, good thanking letter to me. So therefore, in those days, it was surprise to me. I don't advise that everybody who gets a stent should immediately next day go on world tour. I'm not prescribing that to you. But what I'm trying to say, that once the circulation is re-established, and if the heart's pumping power is normal, he can do anything that any other normal man of his age, his standard, his risk factor can do. He's allowed. Um, on the other hand, your second question is, I think, is unfortunately a little more disappointing in the sense, in the terms of its outcome. Well, people who have a very poor pumping power of the heart, normal heart's power is 55%, not 100%, 55. But people who have heart's pumping power of 35% or less, due to damage created because of the previous heart attack, they cannot adequately empty the content. The heart cannot empty the content of its cavity, and therefore the patient retains the fluid back into the heart. The blood stagnates in the heart, and therefore the lungs can't deliver the blood back to the heart. And that way it keeps on going on to the back. From the lungs, it goes back to the right side of the heart, and there is a swelling in the body. That's a bad sign. This is, we call in medical parlor, heart failure. They require treatment with medications, all right, but if the medications don't work, then in that situations, they require many things like the artificial heart transplant, so on and so forth. It all depends. If it's a class 1, just the beginning, then we continue to manage medically. But if the patient is very young, pumping power is 10 to 15% only, can't carry on out day-to-day activity, and is aspirant of good quality of life, is 25, 30, then he's a candidate for heart transplant.
My heart pumping is 42%.
That's
and
good.
I'm 65 years.
Heart 42 is good. Anything above 35 is within the manageable limits. You will have a social adequacy. And there are medications which help you too.
Okay, thank you.
Last question for the evening. Sangeeta?
Yeah, can I take that? Yeah. Doctor, what is the difference between a heart attack and a cardiac arrest? Is there a difference?
You see, when there is a complete cessation of the heart's activity, when the heart comes to a standstill, then it will stop circulating blood. Zero. At that point of time, the brain, which cannot sustain the lack of oxygen for more than 3 to 4 minutes, and if the heart's circulation is not restarted within that period of time, then the brain dies permanently and forever. And in our parlor, when the heart is stopped, is not declared as death. When the brain is dead, the patient is considered as dead. So this is when the cardiac arrest takes place. And if you are there around, and if you have recognized that this is cardiac arrest, you can start the external cardiac massage or cardiac resuscitation. And that, I think, when the opportunity comes, I think it should be, I would insist that it should be learned by all the family members of a patient who has a heart problem. In fact, it should be therefore now in cinema houses, in the lecture halls, at various strategic points, at the airports, we all have a defibrillation, the shocking machine that can restart the heart when it's in a cardiac standstill. Heart attack is one which I described. When the artery gets completely blocked, the patient gets a severe chest pain, portion of the heart which does not receive any blood supply dies, but the heart still may continue to pump. Such a patient has an opportunity to get treated. Cardiac standstill, you have 2 to 3 minutes of time to revive the heart and not more than that. So this is the difference.
Thank you.
Yeah. Can I ask one question?
Yeah.
Yeah, Ashwin.
I guess
Ashwin bhai,
the topic is so fantastic, guys. Just, Doctor, would it be convenient if a few questions come to you, maybe by email or something?
By all means. And ordinarily, if it was a not a virtual but actual meeting, you and I will be enjoying the nice, good, sumptuous lunch together then at the end of the meeting. But it's too bad that in virtual meeting, you and I, we all have to make our own arrangements. You for yourself, me for myself.
Yes.
Okay.
Smita, next time I can do it for everybody. Yeah? Just a reminder.
Okay.
Absolutely, absolutely, guys.
Okay.
But doctor, it has been a complete privilege. It's our privilege that you could spend this time and give us this superbly informative session. So really, really, thank you very much for that.
Pleasure.
Sangeeta, can you please give the formal vote of thanks, please?
Yeah, sure. Thank you, Dr. Mehta, for this very informative talk and making us aware of the harmful effects of tobacco, alcohol, sedentary lifestyle, diabetes, hypertension, family history, obesity, and so much more detail. I'm sure moving forward, we will all be more particular about making the right choices for ourselves, for our families, and walking 10,000 steps daily towards good health. I also thank Himalini and Preetham Samant for organizing this for RCB. Thank you.
Thank you so much. Thanks again for inviting me, Smita. I've enjoyed. I think it was a very, very elegant audience. Lots of good questions, and I enjoyed.
Thank you so much, Doctor. Tejal, can you please give the secretarial announcements, please?
Yeah, hello everybody. We've had 84 logins today. The next meeting is on the 23rd of April. The details will be announced. Thank you.
Bye, everyone. Thanks a lot.
Everybody. Thank you, everyone.
Smita, you didn't get my message.
What was the message?
When Doc was announcing that there is scrumptious food and everybody goes and eats their own food at their own places.